Class enough. Okay. So far we discussed about types of anemias. You already know. Then we discussed about absolute values. Then we discussed about bone marrow aspiration and biopsy, right? So what is the difference between bone marrow aspiration and biopsy? So aspiration we are collecting the fluid portion of the bone marrow, whereas in biopsy we will take the tissue of the bone marrow, right? What is the purpose of bone marrow biopsy or aspiration? What is the purpose? Yes, to know leukemias, to diagnose leukemias, to know the stage of cancer of leukemia, to know the type of leukemia, either it's a myeloproliferative leukemia or lymphoproliferative leukemia, and to know the response of bone marrow to the anemia and bone marrow dysfunctions. All bone marrow related issues can be diagnosed with the help of bone marrow aspiration and biopsy. What is the needle that we are using for biopsy? Jamshedi needle. And yeah, this is all about bone marrow aspiration and biopsy. Then write down few more things. So I'm directly going to the topic. This is Jamshedi needle, bone marrow biopsy. Then we discuss the procedure. Then a purpose you already understood, right? To understand the stage of cancer, for evaluating the bone marrow function, to detect infections that are causing problems to the bone marrow, to monitor treatment response in case of chemotherapy, and to diagnose fevers of unknown origin. Okay, might be some malignancies. In some cancers there will be fevers. Okay, then genetic testing and iron storage evaluations will be studied. That is the purpose of bone marrow aspiration. Then the second important thing is how to collect a sample. Okay, so that is the second topic, that is collection of bone marrow. So write down these steps. That's it. Only these 10 steps. Collection of bone marrow. Procedure of collection of bone marrow. Procedure of collection of bone marrow. Procedure of collection of bone marrow. The first and foremost thing, patient preparation. So directly write only these steps. This one you can check in the notes afterwards. Okay. First one, patient preparation. In patient preparation, I1, what is the important thing we need to do? We need to collect informed consent. Okay, informed consent from the patient preparation. Then second one, site selection. What are the 3 sites of bone marrow sampling? Sites of bone marrow sampling: sternum, iliac crest of hip bone, and pelvic ridge. That is pelvic ridge. One more. Okay, the shaft of the epiphysis of bone, long bones. Okay, from long bones, sternum and iliac crest of hip bone. Okay, these are the sites. Then yes, we will clean the site. Then after cleaning the site of bone marrow, then what we will do? We will give local anesthesia. So we will provide local anesthesia. Keep in mind, this is local anesthesia, not overall body anesthesia. Local anesthesia will reduce the pain during the procedure. Okay, but keep in mind, bone, we cannot give anesthesia to the bone. So still the patient will experience some pain, and there is no other choice. Okay, so we have given local anesthesia. Upon giving local anesthesia, we will make a small incision. Why we are making small incision with a surgical blade? Because the gauge size is very small. Keep in mind, gauge size small means the needle will be big. Big needle, small gauge size. Big gauge number, smaller needle. Since we are using large needle, small gauge needle, I hope you understood that. It's a large needle, so first we will cut a small incision we will provide. Then we will go for keeping the Jamshedi needle. Then next what we are doing, we are inserting the biopsy needle. Then we will drill the bone marrow until it is entering into the bone marrow. Right? We will drill the bone until it reaches to the bone marrow. Then after that, we will start collecting the sampling. It can be a fluid or it can be a tissue. So we will collect the sample. Then we will withdraw, and applying pressure, we will withdraw the needle. Then we will dress the site. Dressing the site means post-operational procedures. So you will again clean the blood and you will dress the site. Okay, you will keep cotton and some gauze cloth. Then post-procedure care. Ideally, after bone marrow aspiration or a biopsy, within 2 hours patient can go to their homes. Okay, this is not a over day procedure. After 2 hours, we need to ensure that there is no discomfort to the patient. There should not be any excessive bleeding, right? Then last and final, sample processing and analysis. Okay, keep in mind, in sample processing and analysis, one important parameter: adequate criteria for adequate sampling. Criteria for adequate sampling. Criteria for adequate sampling. How we will ensure that we obtained an adequate sample? So the criteria is very simple. At least we should get 1.5 centimeters of tissue sample in case of biopsy. 1.5 centimeters of tissue sample. Tissue sample should be minimum 1.5 centimeters length. Okay, very small, but still. Okay, 1.5 is a minimum required criteria. Then, yeah, that's it. Clear, right? So this is the procedure of bone marrow aspiration and biopsy. I hope you can go through the notes now. You will understand the notes. That's not a big deal. Yes.
Done by the expert doctor or surgeon?
Yeah, this will be done by surgeons or physicians can perform this one. Ideally by surgeons, they will do this procedure. Nurses will aid the patient and lab technicians will give the confirmation of the sample size. Okay, there will be a technician who will say the amount of sample he requires, and there will be a surgeon who is doing the surgery, and nursing will aid. So this is all about bone marrow aspiration. So, yes. So this is all about bone marrow aspiration, and see, as I said, criteria for adequate bone marrow biopsy, that is 1.5 centimeters. At least we should collect it 1.5 centimeters. And that's it. Okay. All right. Then what is the next one? So there is advanced criteria that you can go through it. Okay. Size of the sample, cellularity, quality of specimen, that you will see later. Okay. There are some criteria. Then you already know what is aplastic anemia, right? What is aplastic anemia means? Yeah. Complete dysfunction of bone marrow is called as aplastic anemia. So today's lecture is all about leukemias. What is leukemia means? Cancer to the blood. So blood cancer is called as leukemia. Blood cancer is called as leukemia. So I will keep a small picture here. Yes. In order to understand the leukemia or blood cancers, you must have a basic idea about erythropoiesis. Okay. So, hemopoiesis to be precise. So, in hemopoiesis, there are two important lineages we have seen here. What are those? Myeloid progenitor cells and lymphoid progenitor cells. Myeloid progenitor cells are making megakaryocytes, red blood cells, mast cells, and myeloblast. Myeloblast will make granulocytes and monocytes, right? Then in granulocytes, we have some types of granulocytes. Then in lymphoproliferative, we have natural killer cell and lymphocytes. Is it clear? Listen. Any cancer to these cells is called as lymphoid leukemia. Any cancer to these cells are called as myeloid leukemia. Okay? Now keep in mind the further classification based on the progress of the cancer. Okay, we got a cancer in a patient and how fastly it is progressing, how fastly it is advancing. I mean, how fastly the patient can die in a nutshell. Okay, after getting a cancer, how fastly the patient can die. If the patient dies in a year or 2 years, such cancers are called as acute. If they will die within 5-10 years, they will be chronic. Here also, acute, chronic. If it is a myeloid, acute myeloid leukemia, chronic myeloid leukemia, acute lymphoid leukemia, chronic lymphoid leukemia. So these are the 4 terms. You already understood, right? AML, CML, ALL and CLL. Are they clear? Yes. Then let us see, let us understand some basics about cancer. Okay, what do you mean by a cancer? Tell me, students.
On growth.
This is a cell. Yeah. What is a cancer? Uncontrolled growth. Is growth correct term? Growth means growth of the cell. That is not correct term.
Division.
Yeah, uncontrolled cell division. Uncontrolled cell division is called as cancer. That you are saying. Maybe you are trying to say that within 3 days, I am just giving an example. Within 3 days, a cell must produce 10 cells. One cell will be divided into 10 cells. Okay? That is the normal cell division. Okay? During cancer condition, rather than 10 cells, there will be 10 million cells. You just imagine now. Instead of 10 cells, there will be 10 million cells. That means the cells are dividing at a rapid pace. And that can be a cancer. Right? This condition is called as cancer condition. Here the cell growth is too much. Okay? If you see movies, if there is a excessive cell division, they will show it as an incredible hulks. Right? A normal person, his tissues enlarged and he became Hulk. In reality, if your tissues enlarge, you will become a cancer patient. Okay? You won't become an incredible Hulk. I think you got my joke. Okay. Yes. Now listen. Before discussing all these cancers, I want to, we should understand the behavior of cancer cell. Is every cells become cancers? Are we prone to cancers every day? Actually, we all prone to cancers each and every day. Each and every day there is a chance of getting some cancers, or the cell will grow uncontrollably. Okay, the triggers might be a UV light. Some UV lights will destroy the DNA, leading to a cancer condition. Some diet, okay, tobacco, alcohol, carcinogens, asbestos dust. Many things can cause DNA damage. So literally it is the DNA damage leading to a cancer. Somehow the cellular DNA has been damaged. Unfortunately, if those cells are stem cells, game over. Because stem cells giving rise to many types of cells. Since stem cell itself got an issue, all these cells will get affected. Is it clear? If this cell got cancer, no issue. Okay, this cell will die. This is a terminally differentiated cell. But here, if the stem cell get an issue, entire lineage will get affected. Entire cell lineage will get affected. Right? So yeah, that is the problem in cancers. Now listen. Whenever there is a stress, like UV light or anything, there is a natural mechanism where there is something called programmed cell death. In our body, we have a P53 gene. This P53 gene, keep in mind, P53 very important. This P53 gene will control the number of cells. You know, they are really disturbing me. Okay. In between classes. See? Programmed cell death. Okay. After 10 divisions, a cell will suicide itself. Okay. That is called programmed cell death. Okay. And unprogrammed cell death means, unprogrammed cell death is a different story. In unprogrammed cell death, the cell was attacked by some virus, parasite or something. That is uncontrolled cell death. Okay. Yeah, uncontrolled cell death can happen. Or here, uncontrolled cell division will happen when P53 gene got some mutations. Mutations in P53 gene leads to an uncontrollable cell division. It leads to a cancer. So P53 is one marker to identify a cancer. See, P53 will maintain it will maintain the number of times a cell will divide. I can say a person can only have 10 children, and the rule is P53. When there is no rule, the person can have 100 or 10,000 children. Similarly, a cell will lose its program and cell will divide uncontrollably. and that is a huge consequences will be there. By the way, why an uncontrolled cells causing issues? Because these cells will interfere with other cells. These cells will take all the nutrients and they won't give nutrients to other cells. I will tell one nice thing. Cancers are like aliens. Okay. Very important analogy. Pay attention. Very, very important analogy. Where I need to discuss. See, this is a tissue. Maybe I will show a tissue here. So this is a tissue. Okay. Unfortunately, these tissue cells became a cancer cells. The tissue cells become a cancer cells. What these cancer cells will do is, they will show very interesting phenomenon. Since they are uncontrollably growing, they need more nutrients. Am I correct? That means when they need more nutrients, they need more blood vessels. What they will do is, they will release some particular cytokines. These cytokines will trigger the nearby capillaries to, there will be more capillary, there will be more blood supply to this site. Okay, this is called as angiogenesis. Angiogenesis. A new blood vessels will be came to the site of cancer. This is a really interesting behavior. Okay, so now they are getting more nutrients. They are getting more nutrients. They can even more divide. So when they are drawing more nutrients, what happens to the other normal cells? They will be deprived with nutrients. They will die because of malnutrition. You just imagine if this cancer is around the heart, okay, maybe in the lungs. Now this cancer taking all nutrients to the lungs, leading to a lung cancer. At the same time, this also making the surrounding environment deficient. The heart or surrounding cells won't get enough nutrition. Okay. Now, now we draw more blood. After that, the tumor will start increasing. There will be a small bump in the tissue. There are more cells made a microtumor. Now there is a small tumor formation. Okay. After tumor formation, the third stage is very interesting. There are nearby lymphatic vessels. Okay, there are nearby lymphatic vessels. Now, these vigorous cancer cells will start entering into the lymphatic vessel. They will migrate to the nearby lymph node. They will make another cancer tumor here. They will migrate to another lymph node. They will make another cancer tumor. Slowly they will gain access to the entire body. This mode of spreading of cancer is called as metastasis. Metastasis is a phenomenon of spreading of cancer cells. Spreading of cancer cells is called as metastasis. So I have discussed about three behaviors of a cancer. The three behaviors are: first, the cancer cells has overpopulated. There is an overpopulated and there is a microtumor formation. There is a tumor formation. Number one, tumors have formed. Microtumors has been formed. Then what is the second phase? The tumors escaped into the lymph nodes. Second stage, tumors entered into the nodes. When I say nodes, that means lymph nodes. They entered into the lymph nodes. After they are gaining access into the lymph nodes, what they did? They started spreading into the body. Now the cancer tumors started spreading entire body. Okay, that is metastasis. Metastasis means spreading of cancer. The phenomenon of spreading of cancer is called as metastasis. Then lymph nodes. Okay. Now, based on these three characteristic features, based on these three properties, the cancer stage will be decided. The cancer stage is calculated by considering these three stages. Okay, the cancer stage is decided by calculating these three phases. What are the three phases? Tumor, nodes spreading, and metastasis. What is the size of the tumor? What is the aggressiveness of the tumor? And what is the volume of the tumor? Based on this, we have tumor classification. Then we have number of nodes. How many nodes has been affected by the cancer cell? 1 node, 2 nodes, 3 nodes, multiple nodes, or no nodes. Okay. So based on number of nodes, the stage will be calculated and the type of metastasis. The length of the spread of cancer from the site of origin. Okay. Now, is it clear?
Yes, sir.
So now you understood some more insights that cancer has these three phases: tumor formations, node spreading into the lymph nodes, and metastasis phenomenon. Based on these three things, we are calculating cancer stage 0 to stage 5. Okay, advanced stage. Okay. Now, overall, cancer was divided into two types. Let us see what is it. If the cancer not going to spread, if the cancer not going to enter into metastatic stage, if cancer is just a localized tumor, if the cancer not going to access lymph nodes and going to metastasis, if it only stay in that particular tissue, such cancers are called as benign cancers. Assume there is a cancer in your pancreas and the cancer is only a tumor stage and it is not spreading into other tissues. Okay, it is a localized tumor. A localized tumor is called as a benign cancer. A localized tumor, don't talk, students. Okay, a localized tumor is called as a benign cancer. Okay, yeah. See, if your tumor is only in the pancreas and it is not gaining access to lymph nodes and spreading, such tumors are called as localized tumors. Such cancers are called as benign cancers. Okay, one best example is breast cancer. Okay, breast cancer, this cancer will be there in a lacrimal glands, okay, in the mammary gland. Usually a breast cancer tumors won't spread to other body. Okay, ideally, when we see the behavior of the tumor. At that instance, if the tumor not spreading to other body, the only remedy is we will cut off the tissue. We will remove the tissue and it won't spread. Okay, so mastectomy. Okay, we will remove the breast or that particular tissue. Okay, benign cancers are treatable. They are somewhat manageable. They are somewhat a safe cancers, we can say. One example, breast cancer. Second example, cervical cancers. You have heard about this one, right? The woman got some a lump of tissue in, they're in big operation. They will say she underwent big operation, she won't get any periods. No, usually these patients, they won't have periods because we remove their uterus actually. No more, they will achieve menopause. So that is benign cancers. Okay, but never, never be a soft-hearted to benigns. Keep in mind, when you thought it's a benign and you are not treating benign can escape as a metastatic. In the late stage of benign, it can escape to the lymph nodes and it can become a dangerous cancer. Okay, the dangerous cancer is called as malignant cancer. Malignant, the chances of survival of patient is very less in malignant because this cancer originating from one place, it will start spreading entire body and it's very tough. Okay, yeah, malignant cancers are very tough. Unfortunately, 90% of leukemias or 98% of leukemias or blood cancers are malignant in nature. Unfortunately. Okay, that means there is a very less chance of survival by a blood cancer. Unless, again there is an interesting thing, even malignancy has a cure when we identify it in the early stage. When we identify a malignant cancer in its early form, there is a treatment. And what are the signs of cancer? Okay, the problem with leukemia is, the problem with blood cancer is, it will misguide the diagnosis. The first signs and symptoms we will see in a patient will be an anemia symptoms. So what we will do, we will give more vitamin B12 supplementation. Listen, how deadly the misdiagnosis. Okay, pay attention. For example, one patient has a cancer, but we don't know the cancer, okay? He exhibited anemia symptoms. So what I did, first usually what we will do, immediately when you feel weak or laziness, will you go to a specialized hospital? Usually you will go to primary health care or a small doctor. What small doctor will do? They will give vitamin B12 first. They will say CBC, vitamin B12, you go home. Imagine, doctor given vitamin B12 and there is an ongoing cancer in the body, and vitamin B12 is like a drug to a cancer. It got the right nutrients as a supplementation for its rapid growth. Okay, now the patient will feel, okay, now I became normal. There is an ongoing war in the body now. No, the soldiers are rising. You feel normal because this vitamin B12 keeping you alive by, the negative, the positive loop of bone marrow. Bone marrow trying to make more cells, so you are looking like a healthy fit. Okay, you are looking fit. But parallelly there is a cancer. Okay, by the time of showing tumor, that is interesting thing in cancers. A normal cancer cell takes almost 2 to 3 years, at least 6 months to 3 years, to have a visual tumor. By the time of 3 years, you have nurtured the cancer to an extent where it became a deadliest villain now. By the time we thought there is a cancer in the patient, he is already in late stage. He or she will be in the, it will be very challenging. That is the problem with cancers. When we came to know there is a cancer, that is already in the aggressive stage. And that's why what we are doing nowadays is, in India also there is a robust mechanism of surveys among people. We know that there are certain cancers, the population is likely to affected. For example, breast cancer and cervical cancer. So what we are saying to women, after 35 years, every year they must undergo examination of, they should undergo pap smears. The reason pap smear is, in pap smear, if there is an early stage of cancer, we can detect it. Okay? So when we identify abnormal cells, immediately we will start the treatment. And there won't be any issues. Okay? When we see the cancer in early stage, there is 100% cure. Keep in mind. Cancer looks deadly, but they are very friendly actually when we treat them, when they are in their juvenile form, when they are in their baby stage. Okay, yeah, that is the good thing about cancers. Yes.
Lung cancer is a benign or malignant?
Lung, that depends. Okay, that depends by seeing the biopsies. We cannot judge. Okay, only with surface knowledge. We should see. Okay, that's why this is a big deal.
For example,
Yeah.
example, malignant cancer.
Malignant cancer, I will say like this, every malignant starts as a benign. Every malignant starts as a benign.
So we can write a brain cancer.
Yeah, that depends. Every cancer, I'm saying. Okay, any doubts? Symptoms. Listen, by the time when, for example, there is a woman suspected she has there is a heart bump in the chest, okay? So when they, by the time of she's realizing there is a heart bump, by that time the cancer entered into the second stage. Might be it starts spreading into lymph nodes. Because it takes almost 2 years to make a tumor. That means already there is a cancer cells in the chest, but she didn't identify because there is no hard tissue. Okay. cancers are always, they will misguide us. Okay, the whole, and we never do like this, right? We never say when there is an issue, okay, do cancer testings. We never do it because these tests are very costly. Yeah, they will always misguide us. That is one problem with cancers. Unless and until there are some congenital issues. When the baby itself looking abnormal, then we will go with all profiles. Okay. Yeah.
If there is an unknown cancer technique to identify cancer early.
Yes, Sachin?
There is another technique in the world to identify cancer earlier.
There are 1,000 ways to detect cancer, but there are 10,000 ways to misdiagnose the cancer. Now you understood, right? I will tell one simple thing. Listen. Maybe Shaurabh got some small, chicken pox like nodule. Will I assume he has a cancer? No one of us will assume it's a cancer, and that's how it is misdiagnosed. Got it? One interesting thing is when my son joined in PGI, I re-studied these things, okay? They started checking some black spots on the body. They are called as Mongolian spots in children, okay? Like a birthmarks, okay? Some of the birthmarks are cancers. They look like a birthmark, okay? But they are the cancers actually. So they saw and I was literally afraid. They said, okay, there is a Mongolian mark, there is a Mongolian mark on him. Then I was scared. Then I came to know that is normal things which will be exhibited by children, okay? But but also exhibited by cancer patients. Mongolian spots can be exhibited by cancer individuals also. So it's a heartbreak. So that's why doctors won't tell these things until they are true, they are confirmed. Since I know some of I have the loophole, I studied and I was afraid. And I was very polite to everyone. Is everything fine? Is everything fine? Then I said, I'm glad that it is tell me. I can understand. Then they said, okay. Yeah. Yes, anyway.
Sir?
Yes. Knowledge is deadly sometimes. It will make us anxious. Yes.
Sir, as you mentioned that if we detect the cancer in the early stage, it can be cured. But sir, as in many cases that it cannot be cured and it can then fix the and it can cause at that time it can cause
Deadly devastations in the body. That's why treating those patients is very tough. Okay, class, if you have doubts, you should ask me, right? I appreciate that you got some, triggers about this topic. Yes. Yes. No reason. Fine. I appreciate your curiosity on cancers, but it's really interesting. Very good. Coming back to the topic. Yeah. I thought, yes. Any more doubts? I thought of discussing one topic. Yes, listen now. Yeah, listen. How to diagnose it? Now my question, all of your question is same. I know. What are your concerns or confusions? How to detect a cancer in the early stage? Because I said early stage we can't detect. Am I correct?
Yes, sir.
How to detect cancer in the early stage? That we will know now. Now pay attention. How to detect a cancer in early stage? How to the 10 clues of cancer, I can say. What clues it is giving us to show a cancer exhibition, okay? The progress of cancer. Listen, whenever a normal cell under stress, stress can be many triggers. I will write the triggers here. Some triggers are malnutrition, okay, less diet, you are not taking diet properly. Some UV environmental, some infections, okay. Whenever there is a stress to a cell will try to undergo something called adaptation. Simply it won't become a cancer actually. Cell will try to adapt to the stress. One example is you are stressing your muscles a lot with gym. What happens to the muscles now? The cells will enlarge, and that is an adaptation, and that's how you got a muscles. Actually, excessive gym is a torture to the muscles actually. Okay, that's a stress to the cell. Anyway, that we'll see later. Adaptation. Now, write down the types of adaptation. I will directly show. If the cell size reduced during a stress, when the cell size reduced during a stress, that is called as atrophy. Atrophy. When the cell size reduced during stress, that is an atrophy. Okay? An atrophic cell can lead to a cancer. That is one clue now. Okay? Why my cell? I know that here the cell size should be this much, but cell becomes small. That is one clue. What is the stress? What trigger causing my cell to become small? If I investigate then I might know it might be a cancer. Understood? I can give one classic example. It can be also an MCV, low MCV. See again misguiding. Can a low MCV be a cancer? We won't think. It's a microcytic anemia we will think. Okay? See, that is how cancer will be misdiagnosed. One stage we understood atrophy. Atrophy means decreased cell size. Let us see second thing. That is increased cell size. We will think MCV increased in case of RBC. Right? This is called as hypertrophy. 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 Then second one, third one, sorry, okay? Third stress. The third stress is increasing number of cells. Increasing number of cells. Keep in mind, even in normal conditions, sometimes cell count will increase. One example will be a breastfeeding mother. Okay, now upon delivery, the mother's breast will increase. The reason is there is a increased cell count. Does that mean a cancer? Not a cancer. It's a normal physiological process. Then how would you differentiate a normal increased cell count with a cancer increased cell count? Got my point? Again, misdiagnosis happens. Got it? Yeah. Example, this is called as hyperplasia. Hyperplasia. Examples are pregnant woman breast enlargement or lactation woman breast enlargement and puberty. Upon reaching puberty, every one of us will have tissue hyperplasias. That's a normal condition. Plasia. Hyperplasia. Hyperplasia. Okay. I will give one friendly word to the cancer. We all are products of cancers actually, in a friendly manner. How means a sperm and ovum started a cancerous division, becoming an adult human, Yeah, actually we need cancer. That's how the nature works. Yeah, yes, you understood my point, right? That's the loophole of cancers actually. The normal behavior itself is a cell growth. But when there is some problem with uncontrolled cell growth, that becomes a cancer. Yeah. So the software itself has a glitch. Software is, yeah. Yes. We can't do anything. Yeah. Fourth one. Anyway. Next to adaptation. Write down adaptations. All these are stress. These are called as cellular adaptations. You can say classically these are cell adaptations under stress. Types of cell adaptations. Is it clear? Next one, write down. One type of cell is replaced by a different type of cell in that region. Maybe a columnar cells must be there in the trachea, or in the gut lining there should be columnar cells. But when you took the biopsy, the columnar cells are replaced with cuboidal cells. This is called as cell transformation. Okay? This is also called as metaplasia. Metaplasia. Replacement of one cell type with other cell type is called as metaplasia. Replacement of one type of cell into another type. Okay? The transformation of cells is called as metaplasia. Okay? Usually metaplasia is seen among a woman during pregnancy and non-pregnancy time. Non-pregnancy time uterus looks normal, but during pregnancy time there will be changes in the cell, tissue, not a cancer condition. But even in cancer condition, this behavior can be seen. See, very challenging. You know, I will tell one story. I already said to you, in Kerala it happened. A woman came with some breast tumor and she was given chemo and she lost all her weight, everything, and she died during chemotherapy. During her death report, we came to know she didn't have cancer at all. Got my point? A woman was misdiagnosed with chemotherapy because she has a lump in the breast. They made a biopsy also. Even biopsy misguided us. Because these things, by seeing the replacement of cells, we thought it's a cancer, it's a benign, let us give a chemo. Yeah, cancers are very tough.
Yes.
Cancers will come with a friendly face. See, very tough. Yes, next, fifth one. Yes, right now, next one. Okay, abnormal. Right now, next one. Atypical growth, atypical size. There is no problem. There is a condition where cells are like this. Atypical growth, atypical size, atypical shapes. Atypical growth, atypical size, atypical shapes. Seen in one type of cancer, such cancer is called as dysplasia. Dysplasia is a strong candidate of cancer. When there is a dysplastic cells, it's a chance it might be a cancer. But dysplasia also has a friendly face. That is transitional epithelium. Pseudo-stratified epithelium. Do you remember what is pseudo-stratified epithelium? False multiple layered epithelium. Even that looks like a dysplastic tissue. A pseudo-stratified epithelium looks like a dysplastic tissue. A true dysplastic from a pseudo-stratified epithelium. Again, misdiagnosis happens. Okay. Every cancer state has a friendly nature. That's the problem. Okay. Dysplasia. In dysplasia, there will be an abnormal size, shape, transformation of cells. Okay. Last and final.
Sir, can you repeat the second?
Okay. Which one? This
Second.
hypertrophy, increase cell size.
Hypertrophy.
Okay. Now listen. Okay. A severe dysplasia condition. Severe dysplasia condition is called as anaplasia. A severe dysplasia is anaplasia. I will give an example of anaplasia. Okay. Doctors suspected a tumor in the intestine. They removed the tumor. In the tumor, there is a hair, eyes and teeth to the tumor in the intestine. They removed a tumor. The tumor has hair, teeth, eyes also there to the tumor from the stomach. That is called as teratoma. You just search teratoma in online. That is a very nice cancer. You know, very weird. Teratoma. Teratoma. Yeah. There will be eyes in the stomach.
So real eyes and real.
Yes. I will show you pictures in online. Wait. Okay, teratoma. Okay. Now listen. Last and final. Okay. Last and final. The worst stage of a cell adoption. An uncontrolled cell growth. Uncontrolled cell growth is neoplasm. Neoplasia. Neoplasia is a true cancer. It's a cancer condition. There is no other option. Neoplasia is a cancer. That's why by the time of, okay, now listen very carefully. By the time of neoplasia, this is neoplastic cells, but they are not tumors yet. They didn't make tumors, but they underwent these many stages, and these stages will take almost 1 to 3 years. Got my point? During this time, we will be misdiagnosed again. Got my point? Yeah, these are the interesting things about cancer, and I will show you teratoma, then we will finish it. Ma'am came, right? Ma'am, 5 minutes. 5 minutes.
Actually, I'm having.
Yeah. So today we discussed many interesting things. Miss Navjot White, Miss Simran, Geeta, Abhishek, Keshav, Navjot, Niketan. Are we are discussing something very serious and you are laughing there. I think I should show you again that bone marrow aspiration and cancer. Okay, anyway. So I don't want to make fun, I'm sorry. Back to the point. Okay? I said teratomas, right? What is teratomas means? Yeah, I said this. I will show you a teratoma. Yeah. Fine. Listen. So, these are the stages of cell adoptions before becoming into a neoplastic cell. What is the meaning of neoplasm means? A juvenile cancer cell is called as the starting stage of cancer cell is neoplasm. Okay. So what are the stages? Tell me. Atrophy, hypertrophy, hyperplasia, dysplasia, metaplasia, anaplasia, then neoplasm. Neoplasm. Okay. Yeah. How to differentiate a cancer from normal cell? Yeah. Yes, might happen. Listen. Now keep in mind how to differentiate. Class, listen. How to differentiate a normal cell from a cancer cell. This is our next problem. Okay, both look same actually. How to differentiate a normal cell from cancer cell. Okay, write down the points. Heading: how to differentiation between normal cell from cancer cell. Okay, this is what the cytotechnologist and pathologist will do actually. Okay, they know very well about these pictures of cells. Okay, write down how to differentiate a normal cell from cancer cell. 1. Cell nuclear size ratio of cell nucleus to plasma. Cell nucleus to plasma ratio. Cell nucleus to plasma ratio. Keep in mind, in cancer cells, the nucleus will be very big. The reason is there is a huge, cell division happening. There is a huge activity of nucleus genes. So nucleus will be large. Okay. Nucleus to plasma ratio, one characteristic feature. Next one. Obviously, cell size and shape. Second parameter. Cell size and shape. The size and shape will be varied comparing to a normal cell. Okay. Cell size and shape, nucleus to plasma ratio. Third one, chromatin patterns. Chromatin patterns and nucleoli number. This is nucleus and this is chromatin. We will add a dye to the nucleus. There will be colors to the chromatin. So there will be a huge chromatin activity in a cell. When there is excessive dye intake into the nucleus, indicates a cancer, might be a cancer. Okay, and also nucleoli will be present in the nucleus. More nucleoli will present in a cancer cell. Okay, keep in mind, again misdiagnosis happens because of overstaining, because of some debris in the sample. There are many point of errors happens in the diagnosis. Keep in mind. Overstaining can look like excessive chromatin. Debris or vacuoles looks like increased nucleoli. So need to be cautious. Fourth parameter: presence of more immature cells in the tissue. Presence of more immature or blast cells. Obviously, cancer cell stem cells. Okay, blast cells is one condition. Presence of more immature cells. Presence of more immature cells is one characteristic feature of cancer cell. Then fifth one, tendency of cellular clustering and transformation. Tendency of cellular clusterization and transformation. Tendency of cellular transformation and clusterization. Is there any faculty? If anyone can, let me know. Okay, come. Don't make them stand there. Come. Okay. Clusterization and transformation. Tendency of cellular clusterization and transformation. Next one. Presence of atypical abnormal cells. Presence of atypical abnormal cells in the suspected site of cancer. Presence of atypical abnormal cells in the site of suspicion. In the site of suspicion. Okay? I suspected there is a cancer in the buccal cavity. I took a biopsy and I was trying to see a epithelial cells, but there are other cells. Might be a cancer. Okay? Yes. Last and final, for leukemia specific, overall CBC count. Overall CBC count. Overall CBC count. So these parameters can give us. I have given a very surface knowledge. There are further scalings, gradings for individual parameters actually. We are not going to study in-depth cancerology here. Study of cancer is called as what, by the way?
Yes, sir.
Yeah. Cancer, study of cancer is called as cancerology.
Oncology.
Huh?
Oncology.
Very good. Oncology. Well done. Appreciate yourself. Clap for you. Yeah. Oncology. Okay, oncology. Very good.